Some issues opening a document in an iPad that the therapist has sent in the site. So sometimes we have had issues about that, but we are working on improving the functionality, particularly for clients, because they prefer to use it on the iPad. But at the moment, our message to therapists is that you need to practice in a computer or an iPad. So also ensures that you have the therapy space.
Yeah. Yes.
Okay. Any other comments or questions?
I've got a question about kind of encouraging NHS trusts to kind of adopt more digital ways of working, because I work in a stroke rehab team. It's called early supported discharge, so you might think, well, what on earth is she doing here thinking about digital ways of working? But we work out in the community, going to patients' homes, and actually our resources, like everywhere else in the NHS, are incredibly stretched. I actually had a lady in her 90s a few weeks ago, and I was trying to schedule an appointment and just couldn't do it. I only work 1.5 days a week in this team. She said, well, can we FaceTime? She's in her 90s. And I actually thought, I actually can't do that, because the only way I can do that is on my iPhone. And then I think, well, I don't really know about the kind of information governance issues there. And I went back to the team and to the operations manager, and nobody had a clue about how to make this work. But actually, if we could make it work using something like Zoom, that would be fantastic, because the number of extra, so I work in the borough of Barnet, the traffic, etc., etc. One patient might be half an hour drive from another patient. So anyway, that's the question. Have you got any kind of advice about that?
Alicia.
So in Sussex Partnership Trust, the trust where I do some supervision in the south of England, to my knowledge, there's one pilot that is led by psychiatrists in a crisis and home treatment team where they're using Skype. And I asked the team leader about how they managed to get that through information governance and how they made it happen. And what it seemed to me that the difference is that they got the medical director for the trust, who's a psychiatrist, on board. They got somebody very high level and inspired him. And he therefore supported it and made sure it was pushed through.
Because it seems to me like if we could appeal to the kind of financial savings drive, which clearly this would be, because you'd see so many more people, but it's so difficult to get people to start thinking about doing something differently.
Yeah, I think that most trusts have got a digital lead now. In fact, we've got one on our working party who's the digital lead for East London Foundation Trust, as also a clinical psychologist, and I think it's about targeting the right people to be giving these messages back to, because it's no good us as clinicians just saying to our line managers, this is a good idea, can we do that? People will need to have got it cleared for much higher up in the trust, but they need messages back from us as clinicians of, I couldn't offer a session to this client who was asking me that. They need that sort of feedback about the struggles that are going on. So I think maybe seeking out that person, a chief exec or the digital lead, to be giving some feedback and getting some guidance from.
I've been very surprised if my trust has got a digital lead.
Yeah, I think they all really are getting one now. Yeah, how effective they are is a different matter. How many resources they've got is a different matter. But any other questions at the back?
Thank you. How things will go in control or are actually in control when there are illegal issues, for example, corruption, traffic, or false therapies in this digital area, and it now is protected by any institution.
What's the legal protection for therapists working digitally?
Yes.
Is that
yes, and for the digital, this digital system.
I'm happy to answer that.
Yeah.
You couldn't speak to me. Okay, so I think one of the major reasons that we advocate training is to cover areas such as the legal issues. So first of all, anybody who's working digitally, and digital is a very broad church, because it could be with face-to-face clients who are then going home and putting all their therapy on Facebook, etc., and living it out via Facebook. So, it's a big church in a way. But the first thing to do as a therapist, if you are having any digital involvement, I'll call it online involvement, is to make sure that you're insured, because not all insurance policies cover you to work online. And for example, I had an email from a therapist last week saying she was going to change from Oxygen to some other one because Oxygen now required to think about sanctions and the other ones didn't. And this was implied as a criticism. So I rang the MD of Oxygen up and I said, "What's this all about? I don't understand." And he went, blah, 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 blah. And I went, "Steve, I haven't understood a word. Can you repeat it? Because if I haven't understood it, there's not a therapist who will." And for example, every company in the UK is required to check the United Nations sanctions list to make sure we're not working with somebody who's on the banned sanction list. So you might think that's not very relevant. But actually a lot of therapy happens in Russia. And Russia is on the sanctions list at the moment. This might seem very surreal to you, and I thought it was very surreal. But actually there is a list, which I've now got, of individuals in each of those countries who's on the sanctions list. And all the insurer is asking is that we check that sanctions list before we take on a client with that name. So in Afghanistan, and I supervise therapists who work in Afghanistan, the first name on the Afghanistan list, which is by the way on the sanctions list, is Abdul Izaz, or something like that anyway. And there's probably 100,000 of those in Afghanistan, so it's very, very difficult. But the main point is, when you go for insurance, don't think because one company is saying, "Oh, we're covering this," that the others aren't. Something like sanctions is now covered by all, has to be required by law to be covered by all companies in the UK. That includes NHS trusts, by the way. And that only came to light because one insurance company took it up. So that's an example. Insurance would be one. Jurisdiction. Say you've got a client who's in Rome. A child protection issue. Let's say it's a couple who've moved to Rome for business purposes and the husband is alcoholic and quite aggressive and the wife is stuck at home with the children. What would you do? So these are the sorts of issues that require thinking about from a legal point of view, and there's lots and lots of them, and it's not something I can cover in a 1-minute answer, really.
Is there any advice on the ACTO website about this that would be helpful for participants?
No, there's no specific. That's a very good question. There is no specific advice about legal matters. What we would say in ACTO is that because of these matters, everybody working online and every supervisor supervising online therapists should be trained, because you can't possibly know what you don't know.
Yeah, and for example, with the collaboration between ISO and Royal Holloway, where we would normally just encourage trainees to get their own private insurance for practice, if they're doing that online work that's outside, in essence, of their NHS practice, they're required to have separate insurance. So insurance is an important thing to think about in terms of practice. Any other questions?
Well, as we're BPS here, and it's been said that the BPS didn't want to be part of these guidelines, is there something that we should be saying back to the relevant level? Rather than us
Catherine Dooley, who was here earlier.
Yeah.
Oh. Do you want to say something about, because the broader BPS is taking this as a priority, aren't they? So I don't know if you wanted to comment on that.
There's just two things, because I'm the chair of the Workforce Planning Committee for the BPS. And we've been having some events in the last year, horizon scanning, to try and get a sense of what the shape and structure of the profession needs to be in terms of workforce. And one of the areas that came out was this whole area. And it was interesting, there's a discussion that actually, the question I was asking, how much is this going to replace how much they're going to supplement, which obviously is key to the staffing side of things. So that's useful to know. But we're taking it up as far as we can take it up. But actually what's quite good news is, and I don't know any more than I'm telling you, is that the Wessex branch brought this up, and it's on the list for the BPS's strategy meeting in October as being one of the key priorities for the future. And if that's the case, then it'll be taken up, it'll be one of the drivers. So that's all I know.
Yeah. Can I just clarify that? Because I think there are two different strands here. One is training standards, and the second is working online guidelines. I think training standards might be something the BPS might want to do internally, but they could consult with ACTO, who we're working on it. But separately, the working online guidelines, I think, is something that is overarching, and I would warmly welcome, and I say this on behalf of ACTO, warmly welcome all organisations to work together, so we just have one set and we don't divide ourselves in the professions, if we want to call it that, between different sets of guidelines and trying to put a wedge between us.
And in fact, one of the things we're doing as the working group is trying to review all of the international guidelines to draw together some of the themes, rather than just repeat things that have actually been done in quite a detailed and helpful manner elsewhere, internationally.
You have a Spanish already.
So hopefully, and we'll be feeding that back into the BPS, and we've already been talking with Catherine about the way to feed that work back in as well. It's 2 o'clock. We've kept you a long time before lunch, but there's a lovely lunch available upstairs. So please do stay and join us for that and some networking. And I believe the ISO package will still be open upstairs if you didn't have a chance to